International Journal of Health Policy and Management. Quality and speed are our culture and the keys to our success. Welcome to the audio summary section of the International Journal of Health Policy and Management.
Hello, this is Dr. Sara Javanparast from Flinders University in Adelaide, Australia. What I'm going to talk today is to explain very briefly about a paper I, along with my colleagues, Mrs. Alice Windle, Dr. Toby Freeman, and Professor Fran Baum, published in the International Journal of Health Policy and Management. The key focus of this paper is on the role and contribution of community health workers in Australian primary healthcare system. Community health workers has been used for many years, especially in the context of low and middle income countries, to help improving access to basic health services in rural and remote areas, or for population groups who experience disadvantage. However, within the last decades, there's been a growing interest of the use of community health workers and the implementation of community health workers programs in the context of high-income countries. And so what we tried to do in this study to look at the Australian context and to actually examine the range of programs of community health workers and their scope of practice, and how well they are documented and reported. And what we found that although there are many examples of programs that are very effective and they do great job in working with different community groups and providing a range of services, from basic clinical services to more health literacy programs or advocacy work. Most of the programs are fragmented, they are short funded, and they are not well documented, and also their effectiveness is not evaluated and reported. So the main example of the community health workers programs in Australia is the Aboriginal health workers, that they are, compared with many other programs, are well recognized and well documented, and they do provide a range of services at different settings, including primary healthcare settings, to Aboriginal and Torres Strait Islander people in Australia. The second example that we found, which is common in relation to other programs, is the ethnic health workers or bilingual health workers. There are people who work with different migrant population or people from different ethnic groups to help them to navigate the health system and to improve their access to primary healthcare services. And they also provide a range of services to this group of population. And so what we concluded in this study is that there is the whole community health workers program, they could offer a great opportunity to enhance equity of access to primary healthcare service in the context of high-income countries such as Australia, there are many lessons that can be learned from other contexts to implement and to use in the context of high-income countries. And also in terms of research, we have found that there is a need for more funding and research support to do more work on community health workers program and their effectiveness, and in this way to produce strong evidence to inform future policies in relation to health workers in general and community health workers in particular in Australian context. Thank you.